High functioning doesn't mean not struggling. It means masking, navigating, and adapting, often without the support that's truly needed. Have you ever heard of high-functioning autism? Chances are, if you're watching this video, then probably so. But what does it mean, and how many people actually have it? Hi everyone, welcome back to our channel, where we bring you the latest news, research, and discoveries related to autism spectrum disorder. If you love everything autism, make sure to subscribe to get notified when we upload a new video. I have a free guide for you called the Calm and Connected Parent Starter Kit. 7 days to reduce stress and support your neurodivergent child. According to the Diagnostic and Statistical Manual of Mental Disorders, 5th edition, or DSM-5, the criteria for diagnosing autism spectrum disorder include deficits in social communication and interaction across multiple contexts, restricted repetitive patterns of behavior, interests, or activities and symptoms that impact everyday functioning. However, there was no mention of high or low functioning. That's because autism is a spectrum, and all autistic people are affected differently. For a long time, doctors used terms like high functioning or low functioning to describe how severe an individual's symptoms are. These terms were not official medical terms, and they've since been replaced by the term level of support. This is based on how much support an autistic person needs to participate in everyday activities. According to the American Psychiatric Association, levels of support range from level 1, requiring no support, to level 3, requiring very substantial support. The levels are intended to reflect the range of support needs that autistic people have and to emphasize the need for individualized treatment plans. Levels of support can change over time, and different professionals may classify individuals differently. But there's still a lack of clarity around exactly how these levels are defined. In fact, even the term autism spectrum disorder has been the subject of debate since its introduction in the DSM-5. Some autistic people argue that being autistic is not a disorder and should be described as autism rather than autism spectrum disorder. Regardless, whether you prefer the term autism spectrum disorder or autism, and whether you use the term high functioning or level of support, it's important to remember that every autistic person is different. With that said, we know that some autistic people face unique challenges and misunderstandings due to the nature of their symptoms. So let's take a look at what some of those challenges are. Number 1. Masking. Masking verb is a term used by autistic people to describe the act of hiding our neurodivergence. We may do this by covering up our special interests, or pretending to enjoy social events, or hiding our anxiety through positive facial expressions. It's not always easy to fake being interested in something or pretend that you had fun at a party. So why would anyone want to? Well, masking allows us to blend in and avoid unwanted attention. From a young age, we learn that being autistic will get us strange looks and unkind words. We might even be excluded from playing with other children. As we grow older, we learn that our neurodivergence makes us vulnerable to bullying and social exclusion. To avoid this, many autistic people learn to cover up their neurodivergence. Masking takes a lot of effort. It's mentally exhausting to plan ahead of time what to say and how to act. Not only that, but we also need to monitor our own behavior during social interactions to make sure we do not slip up. When we feel like we've successfully masqueraded, we may feel relieved. However, if we're unsuccessful, we may feel humiliated and stigmatized. This can lead to feelings of isolation and depression. Number 2. Sensory issues. Autistic people often experience sensory issues. These are problems with sensory processing. Sensory processing is the way our brain interprets sensations like touch, sound, smell, taste, sight, and body position. Most people think of sensory issues as sensory hypersensitivities, which are common in autism. People with autism can have heightened responses to certain stimuli. For example, a bright light may be too painful to look at, or a tag on a piece of clothing may be uncomfortably scratchy. However, autistic people can also be hyposensitive to sensory input. We may seek out and enjoy strong sensations like spinning, rocking, or swinging. We may also not notice or care about things like pain or temperature. These sensory issues can affect daily life. For example, having a heightened sensitivity to sounds could make it hard to concentrate at school or work, or having a poor sense of danger could put us at risk of injury. Number 3. Social communication. Another challenge faced by some autistic people is social communication. This can include difficulties understanding social cues, making eye contact, taking turns in conversations, and knowing what to say in certain situations. Because of this, we may be misunderstood or rejected by others. Imagine you're at a party and you don't understand why everyone's staring at you. You may feel anxious or confused. If you're not sure how to respond, you may just stand there awkwardly, which could make others laugh or feel uncomfortable. Even when we try to communicate, our neurodivergence may cause us to speak in an unusual way. We may use an odd tone of voice or speak in a monotone. Some autistic people also have echolalia, which is the repetition of words or phrases. We might repeat something you just said, or something we learned in school. Sometimes we repeat words just for comfort. For employment and education, due to their social communication and sensory issues, some autistic people struggle in educational settings. They may have trouble sitting still, staying focused, or completing assignments on time. As a result, they may not perform as well academically as they could. Outside of school, autistic people may struggle to find and keep a job. Some employers may not understand autism, or may not be willing to accommodate our sensory or communication differences. If an employer doesn't understand autism, they may think we're lazy or unmotivated, or if they think we're too sensitive, they may question our ability to handle stress. 5. Misunderstandings and stigma. All of these challenges can lead to misunderstandings and stigma. Many people don't understand autism. They may view us as weird, strange, or even scary. For example, when someone says they're autistic and mention that they have sensory issues, one might ask, "What do you mean?" Right. Like you're a mutant. The word mutant is derived from the Latin word mutar, which means to change. Being autistic is not a change to our natural state. We're not mutants. We're human beings with a different neurotype. Despite the fact that autism is a naturally occurring neurological difference, some people consider it a disease. This is because they don't understand what it means to be autistic. They may believe that it's contagious or genetic. Because of this, there's a lot of stigma surrounding autism. This can lead to discrimination in education, employment, housing, and public spaces. But there's hope. Acceptance of autism is growing. As more people learn about autism, they begin to accept that being autistic is not a bad thing. There's nothing wrong with us. We just think and process information differently. Autistic people are contributing members of society, and we deserve to be included. Now it's your turn. What misconceptions about autism have you encountered? Have you ever heard the term high-functioning autism before? If so, what did it mean to you? Leave a comment below. We'd love to hear from you. Want to parent your neurodivergent child with more clarity and calm? Get your free Calm and Connected Parent Starter Kit, a powerful 7-day guide to reduce stress, build deeper connection, and create a supportive home environment. Don't forget to subscribe for weekly parenting tools, encouragement, and neurodiversity insights. And now a quick note from our team at ASD. If you enjoyed this video, please hit the like button and share it with others. Thanks for watching. See you next time.